with respect, because I think that the political determinant of whether NHI ever comes into being is persuading poor people that they have a right to healthcare in this country, and that the most efficient way to deliver on that right is through a national health system, whatever we call it. Because I would argue, and I'll come to what Louis said just now, that the truth of the matter is that there will be no NHI, there will be no national health system in South Africa if there is not a movement for a national health system. And at the moment, there is not a movement for a national health system. There is not a health movement. There are bits and pieces. There's TAC and the People's Health Movement and bits of the trade unions and so on. But there is not a unified movement for justice in health. And Robbie, I'm not misrepresenting what you say because it goes to what Louis said, is that the issue is, yes, there's a contest of ideas going on. But also, as Louis said, there is a contest of interests, of vested interests going on around national health insurance. And that is the reason for the delay. I mean, I'm an absentee member of the Ministerial Advisory on National Health Insurance because it was just a waste of time for a long time. It was one of those committees that didn't do anything and didn't go anywhere. Pardon that this is being recorded, but to tell you the truth. But I do know that there has been a contest in government over NHI, in particular between the Treasury and the Ministry of Health, about how NHI should be funded and whether there should be co-payments as a part of access to healthcare services. And also, there is a contest of vested interests, and I'll say a little bit more about the private healthcare sector in a minute, because as we've seen already, private healthcare is very good business in this country. And nobody's proposing to do away with the private healthcare sector. And personally, I don't think that it's feasible or that we should even talk about it. Nobody's actually proposing to do away with the medical aid schemes necessarily. But an efficiently, properly instituted system of national health insurance would make those things redundant and would give cause for them to wither away. And that is what they understand. So again, you know, people leak me lots of documents. So I've seen what Netcare is saying. I've seen what Mediclinic is saying. All of them are lawyered up. All of them they've made their submissions on the green paper. The submissions on the green paper have veiled loyally in between the lines hints of litigation. If the NHI system is not the type of NHI system that they will be satisfied with. And that partially explains, I believe, the delay that we have between the green paper and the white paper. But one of the things I do want to say in this presentation, though, is that I think it's very important that we give credit to the Ministry of Health for some of the public health sector reforms that are being implemented and for the approach that is being taken to national health insurance. And but let me now just get to what I wanted to say. As Fazila said, my feeling is that the starting point for discussion